Good morning friends and my dear parents. This video is more about the coronavirus testing. So coronavirus testing is basically done by the two ways. One test is known as a RT-PCR, that is known as a polymerase chain reaction, and second one is known as a antibody test. So what is the difference between two? See, in the PCR, RT-PCR, basically we are detecting the virus RNA, then we will replicate it, and then we will give the result that whether this virus is there in the swab or not. What about the antibody test? Antibody test is like the indirect indicator whether you are suffering from the coronavirus or not. There are two types of the antibodies we develop with any disease. Like suppose if you have like the dengue fever, so in the dengue fever you will have the one antibody known as IgM and second antibody known as IgG. IgM, see, this Ig is stand for the antibody. Antibodies means your defense, your protection. So IgM will rise first because it is a first fighter of the body. So our certain type of the cells will liberate this IgM. They are stronger antibodies, so they will fight when the virus is there inside your body. Second antibody will come is known as a IgG, immunoglobulin G. IgG is like for your long-term protection. So whenever you will get any infection, first will rise the IgM, then after some times IgG will rise. So when you get the blood test done, like the antibody test for the coronavirus you will do, if your IgM test is positive, that means you are currently infected. You are infected right now. But suppose IgM is negative and IgG is positive, that means you had infection before and you have recovered from it, and now you will have the little bit protection. Now we don't know because the coronavirus has a lot of mutations, lot of different species are there. So whether you are protected for a longer time with the IgG, that we don't know. But so far so good. Most of the countries who has the primary infections, we are not seeing the secondary infection. Suppose in your test IgM and IgG both are positive. That means you are already exposed to the virus, you are already infected, but that infection is little older, so that the IgG has again started rising. That means you are not completely infected also, and you don't have the complete immunity also, so you can transmit the infections. Okay, now again both these tests are not 100% because nothing in the world is 100%. So PCR has the good sensitivity. That means you can detect the virus, so that you can know like the most likely near to 100% that you are affected. But antibody tests are not that much sensitive and that much specific. Okay, so this is the information about how the test is done and what we interpret, what as doctor I interpret. I hope you like this video. Share it, subscribe it. Thank you.